white people. Watch this video, and I'll be right back.
Why is health care not a right in the United States? Back in the I believe it was the 1940s. It was probably the 1950s. The United Nations, in fact, it had to be a little after that. Anyhow, the United Nations negotiated this agreement that pretty much every country in the world except the United States signed, the United Nations Convention on Human Rights, that says health care is a right. And every other developed country in the world except the United States acknowledges that health care is a right and not a privilege. And that's a really important distinction, because when something is defined or recognized by a government as a right, that means that if people don't have access to it, the government has an obligation to provide it. For example, education. We have decided in the United States that education is a right. Everyone has a right to a decent education. And that's why if your school is providing your kids, you or your kids, with a substandard education, you have the basis actually for a lawsuit, because you have a right to good education. In every other country, every other developed country in the world, health care is a right. And different governments have figured out different ways to deliver this to everybody. They basically fall into three buckets, but not the United States. We have not defined this as a right. Those three buckets, by the way, are the American system, which is mostly privatized and for-profit health insurance, the socialized medicine system, which is basically the United Kingdom's National Health Service, and the VA hospitals in the United States. And the third is single-payer health care, which is what we have in the United States with Medicare for all, with Medicare, what we would have if we had Medicare for all, and what other countries have with their single-payer systems. So why is it that we never said in the United States health care is a right? Turns out this goes back to the 1880s. In 1884, Germany got their first single-payer health care system. Otto von Bismarck. This is when Germany, this is even before the German Republic. This is when Germany was an empire. And the head of the German Empire, Otto von Bismarck, pushed through a single-payer healthcare system because he said it would keep the populace and the army healthy, lowest expense to the public purse. In other words, it's the best way to do it. And he was right. That same decade, a guy named Friedrich Ludwig Hoffmann left Germany at the age of 17 with $5 in his pocket and came to the United States as an immigrant. And he was a real what's the word? Savant. He was a mathematical savant. This guy with numbers he could do magic with numbers. And he ended up getting a job with a Prudential life insurance company, which at the time was the largest insurance company in the United States. And he was running numbers for them to figure out how much to charge people for their life insurance policies. And he's the guy, Friedrich Hoffmann, he's the guy who figured out that there's an association between smoking cigarettes and getting lung cancer, between being exposed to asbestos and getting mesothelioma, the disease that killed my father, and between working in cotton mills and getting fibrosis of the lungs, and also between eating a diet high in processed foods and getting a variety of types of cancer. In fact, his book on diet and cancer is still in print here in 2021, even though he died in 1946. So anyhow, he directed his numerical work toward the so-called race problem, because Prudential at that time and other life insurance companies were trying to figure out how much to charge for their policies. Originally, they just didn't want to cover black people at all. But then, as a market developed, as some black prosperity was emerging in parts of the United States, the insurance companies were like, okay, what do we charge? And so Hoffman ran the numbers. And sure enough, black people were dying at higher rates than white people, and they were getting sick at higher rates than white people. Now, you and I today in 2021 know that all has something called systemic racism, but that wasn't even a phrase back in the 1890s. And so Friedrich Hoffmann wrote this book based on his math, based on his research, titled Race Traits and Tendencies of the American Negro. He published this in 1896, the same year Plessy versus Ferguson turned America legally and officially into an apartheid nation with, separate but equal. And in his book, Race Traits, Friedrich Hoffmann pointed out that blacks were dying and getting sick, at higher numbers than whites, but then made a couple of logical leaps that he believed the evidence, the numeric evidence, supported, but now we know historically is just nonsense. The first was that this was because the reason why black people were dying at higher rates and getting sick at higher rates was because they were genetically inferior to white people. In fact, he went so far as to say that during slavery, black people were healthy and happy, his phrase. But post-slavery, without the white person to protect them, the black race, his phrase, began to essentially disintegrate. So, which led him to his second hypothesis, which was in his book Race Traits in 1896, which was that if white people who control the politics and most of the economy of the United States simply deny health care to black people, the black race, again his phrase, would die out in 2 or 3 generations. And that would, quote, solve the race problem in America. Frederick Hoffman took this theory, pitched it to Congress, gave lectures all across the United States to state legislatures, met with governors, to physicians groups. He was beloved by those establishments. By the way, he was the co-founder of the American Lung Association. I mean, the guy was no slouch. He was powerful. He was famous, and people took him seriously. Woodrow Wilson. And this is why in 1912, when Teddy Roosevelt proposed a single-payer health care system to cover everybody as part of his square deal plan when he was running for president for re-election, this was why that got shot down, because white people, including the medical establishment, white people by and large said, particularly the white racists in the South, said, wait a minute, if you cover everybody with health insurance, you're going to be covering black people too, and we can't have that. So that ended that discussion in 1912. It's also why they came after Franklin Roosevelt in 1936 when he proposed a single-payer system. It's why they came after Harry Truman in 1947 when he proposed a single-payer health care system. But black people, we can't do that. Black people will get that health care. And this is why they came after John Kennedy in 1961 when he proposed a single-payer health care system. And it's why when Lyndon Johnson and Robert Ball were writing the Medicare law in 1965, the Southern racist conservative senators came to them and said, you need to build into this thing a bar high enough that poor black people in the South, and 60% of black people live in the South right now. It was even a higher proportion back then in the 1960s. So the poor black people in the South won't be able to jump over that bar and show up in our all-white hospitals. So they took Medicare Part B, which is the part that pays for hospitalization, and said, we're only going to pay for 80% of the hospitalization. There'll be a 20% gap, which is the gap that you fill in with your Medigap policy now. That gap was to prevent black people from presenting themselves in hospitals unless it was just an absolute screaming life-ending emergency. So from the beginning through the 1960s, the reason why the United States never acknowledged health care as a right rather than a privilege was because of Hoffman's theories and white racism. I mean, they were just like intertwined. And American racism, I don't know how else to say it. And that prevailed right up until the 1980s, that kind of thinking and that kind of opposition to any kind of health care program that might help black people as well, particularly poor black people, as well as white people. It's why, to this day, 12 former slave states have refused to accept Medicaid, from Texas to Florida. It all goes back to Frederick Hoffman. Which takes us to stage 2, which is, why the healthcare companies, or, why it is that we have not been able, since the 1960s, or the 70s, or the 80s, really it's since the 1980s, why we have not been able to overcome that opposition.
How many times do I have to say this? Racism is a detriment to you white folks, poor white folks especially. Because of racism, you poor white folks can't even get good health care. Because they thought if they could deny health care to black people that we would have been eradicated a long time ago. But hey, we still here. And they have not changed the rules. How crazy is that? Even with Social Security, you have to pay 20% because of racism. We keep telling you. BIPOC keep telling you. Black people keep telling you. It is not us that makes your life suck. It is those racist politicians and their racist legislation that they think that's going to harm us, but harms you at the same time. And they don't care if it harms you. They don't give a shit. And then you continue to vote against your own interests. All because a bunch of rich white people told y'all to hate black people because black people are doing stuff to you as a whole. And we're not, because we don't control shit. We don't control the healthcare system. We don't control Social Security. We don't control your wages. We don't control shit. But they continue to tell you that it's us. So you turn your focus on us and harass the shit out of us for no fucking reason, when we have no power to affect your life as a whole community. Pay attention. Ending racism is not just beneficial to BIPOC. It's super beneficial to poor white folks and middle-class white folks. I said what the fuck I said. Remember, diversity equal power. We can change the world when we work together and protect black women. Until next time.